come in within basically 0 to 2 years, and who spoke very little to no English, and who, to a large degree, were not even literate in Arabic. So an adult learner population, that is sort of the challenge for ESL in general. And so I went in there, and basically it was sort of girls and all women. And we were, drinking coffee, and we were talking to the degree we could about the things that we could. And it was in that classroom that conversations occurred about people. What was so hard for people like having arrived here, how to get your feet on the ground, and how to make a living here. The women had often, for the most part, had been married by men who had American citizenships, Yemeni men who worked here and had been born here, and they had been married and brought in from Yemen, and they, culture shock on many levels. They were not really prepared. They ended up in the Tenderloin, where the rents are cheap, and where there are large immigrant communities. There are large communities of elderly. There are single residency occupancy homes. The Tenderloin is sort of the last place in San Francisco where people who have no money can barely afford to live. So this is how these village women ended up, coming from somewhere where, without any amenities, to a place where they had electricity and water, and then they, were faced with, what the Tenderloin looks like at night and during the day, and they were just not prepared for that. So we talked about all of this, and of course you all know about the Patriot Act, you know about American foreign policy towards Arabs and Muslims. These people were also people that were under surveillance. And they knew exactly that people, FBI could show up at their door. They were under suspicion for violating immigrant rules. They constantly had to figure that their pass, their residencies would be revoked, or they wouldn't get permanent residency. A lot of women had applied to come, and they weren't permanent. They could be sent back. There was a lot of fear. And so working with a community that is, under siege, I don't know how else to say that, and working with that community as an anthropologist raises a lot of very important ethical and larger moral issues. On the one hand, you do want to talk about the injustices that are prevalent in this community and how they're systematically discriminated against. But on the other hand, as an outsider, and I'm obviously not Arab, and I'm obviously not. I'm not sharing their story. There's always this question: why is this woman here asking us questions? And I'm actually so this is partially why right now this whole work is on hold. I'm presenting figures and work that I did 5 years ago, because I got to a point where I thought it really isn't in their best interest that I'm here asking questions, and it is not it's not in my best interest to be, conducting research with that group. And it is, there's no clear cut, or you should be doing research here, or you should go do research. It's always a questioning process, a question and answer format. What is the best thing to do, and what is your role as an academic going into communities that are not academic and that are, marginalized and discriminated against and have no power. You want to empower, you want to be a vehicle through which, voices can be heard. But when the fear there is so great that even if they trust you and they like you, they don't want to talk to you because it makes them look back to their neighbors. Why are they talking to this white woman? And what are they telling her? And could that be? So it creates actually problems within the community. And so there are clear limits. I'm here to engage the point that there's limits to the anthropological work and the community-based work that we do. And it's something we need to just engage in politically think about. And I might actually write about sort of coming as a researcher coming to a point where you say we're not doing research here, and that is actually something that needs to be discussed. So here we have, I brought with me a slide, let's go to the slide, of the health survey that was conducted by the then director of the Arab Cultural Center, Sally Al-Daher. She's actually a medical doctor, and she became the executive director of this cultural center that mostly puts on social events, Arab festivals, celebrations, language classes, music classes, and so forth. But she sort of, because of her own medical background, wanted to do a health survey of the community. And I mean, this came out from a place of an Arab, right? An Arab center with an Arab director, with culturally all appropriated. And even there was a question of her asking herself, should I go into my own community to find out health questions? And what does that raise? And sort of what, should I do that? So it was, in the end, it was conducted. There was a Blue Shield, actually, the insurance company that funded this project. And the 14 people staff from the ACCC went to all these places where there are Arab immigrants and collected 400, in the end it was 395 responses, 50-50, then Muslim and Christian. And it happened that there was, the sample was slightly biased to the younger, 44 and younger, which wasn't intended, but that's how, that's who responded. The older people in general were more suspicious to answer questions. They were more afraid of government interference. They had, I guess, seen more, experienced more, and they were completely, standoffish to this. So, and you would think the elderly population is the one with the health issues that we want to know about. But that's, unfortunately, the people we didn't get to really interview. And I mean, it's things like that, practical things on the ground. Who's then actually going to answer your question? Who's actually going to talk to you? You might have this idea you want to disclose all these things, but then you don't have, you don't have anything to talk about. And also very interesting, 77% had U.S. citizenship. That also reflects that people who had passports and felt they had rights in this country were the ones who answered questionnaires. The people who didn't were waiting and were in this state of limbo. They were not the ones answering the questions. And again, there you might, these are the most recent immigrants, these might be people who just come from war-torn areas, refugees and so forth. These were the people we wanted to hear from. And again, it is the group that we didn't hear from. So I'm already giving you the whole survey with the caveats of what people were hoping to learn and what then the political reality prevents us from learning, for good reason. I mean, if we were a refugee fresh off the boat and they hadn't decided on our permanent resident or temporary residency, we might not want to talk to them. Right? So next one. So what this gives you, the slide is just the nationality count, and this was sort of roughly representational of the San Francisco Arab population. So if you're out on the street and you're running into an Arab, the likely nationality you have in front of you is Palestinian. So you're without even asking him a question, and it's an Arab name, from Palestine. And then see what happens. So, that's sort of the insider knowledge here. And even, the Palestinians who are here are mostly from Ramallah in the West Bank. So, I mean, you can sort of narrow that down. And then we have Iraqis, Egyptians, and Bahrainis. Egyptians and Iraqis and Jordanians. And then the second largest group is the Yemenis. So then what happened, if you give me the next slide, so the sort of general educational background. Actually, give me the next slide on this one. What we did is, because of the response profile of Palestinians most, and the Palestinians are the ones who've been here longest, and they are the ones with the passports. Palestinians came starting in the beginning of the 20th century, and so they've been here, and they are residents and they are citizens. So this sort of explains this, that they are mostly fluent English, that they don't need to fill this out in Arabic but in English. And so this Palestinian influence in San Francisco, which is a very particular immigrant profile, explains a lot of the answers. And then, already down the line, we were saying, well, the Palestinians who've been here and who are citizens who speak English and are educated in our universities, they're not the ones we're worried about. So it is a really interesting sort of experience at going into a study, an immigrant population we know is under siege, we know it's discriminated, we know, and then the people who will talk to the researcher, and these were all Arabs, gathering the interviews. I mean, I did not conduct them. I helped with the analysis later. That in the end, we actually did not get to the data we really so desperately wanted from the people we cared most about. So the very first question, because this was something the people who funded the study, the insurance, actually they wanted to know, what is the experience that these immigrants have with the healthcare providers? And it's sort of actually a classic study in public health. We want to know how are immigrants served by the places that are available to them. All you need to remember from this slide is that the lightest color, the whitish grayish, the always largest sort of column on this is never. And never is the answer to how often were doctors sensitive to your cultural background, how often did doctors ask if you had personal beliefs about your health, how often did they ask about your religious beliefs that might affect your health. Did they share anything personal? Did they ask you about their family? Never, 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 never. That was, on some level, a pretty startling, not entirely unexpected, but very startling finding. And this slide, and the ones that are related to this, they have made it in presentations to all the health centers. I mean, the Arab Community Center has been able to use this information to go to the healthcare providers and say, look, we have an issue, can we work on this? So this has actually been translated already into community action. So this is how, yay for a survey that gives us answers that we can then instrumentalize and go forward with. So this is, I wanted to show that one. So give me the next slide. So for this presentation, chose mental health to just give you the slides that I worked on closest, not because I'm an expert in mental health by any means, but because the data there was just too frightening to sort of not look at. There is a questionnaire tool called the K6. There are 6 standardized questions that are asked on national surveys about people's mental health. And they are, standardized. Answers are always sometimes okay, never, I don't know. And it is standard practice to combine the always and sometimes answers on those questionnaires. This is how it's done every year by surveys that are conducted by the CDC. So the next slide. The Arab Cultural Center, because we had a questionnaire of 79 questions, was much too long. We just cut 2 out. And so they asked these 4 questions from that K6 survey tool. How often in the past 30 days have you felt overwhelmingly sad, nervous, hopeless, or worthless? And so the answers to this one were the following. And so this is the entire data set. And so this is the answers. And the lighter color are women, and the darker color are men. So in responses to negative emotional states, there were, high responses of in the last 30 days. I mean, this last week I felt, right? It's not like, at some point in my life. In the last 30 days, this is sort of the immediacy of it. And women were consistently feeling more stressed or had negative emotions to much larger degree. So then I broke that one down. And I broke it down according to this nationality chart I showed you earlier. Palestinian women, that's the largest single sample. Yemeni women, and then the other groups, nationality groups, the N is so small that statistically it doesn't make sense. So then I put them together into all other nationalities combined in order to compare them. And then the comparison, the Yemeni column is the dark one. I'm sorry that I ran out of color there, so that's color-coded. So the Yemeni ones are the ones with furthest left, the darkest one, the Palestinian are the light-colored one in the middle, and then all other Arab women. And the first first observation, obviously, is that Yemenis feel more distress in all categories across the board. And if you look just at the feeling overwhelmingly sad, I mean, that's sort of the most significant category. There are 40% of answers in that category versus like half in the others. So there we have a pretty startling sort of, revelation of feelings, negative emotional states and feelings and so forth. This, at the same time that we were collecting these numerical data, I was actually in the classroom with the Yemeni immigrant women teaching them English, and we talked about how lonely they felt, how upset they felt, and they said, which in Arabic means I feel narrow and tight, and they actually described the physical constriction that they feel breathing, sort of like can't get air. So if you feel there's something tightening your chest, and this is the expression that they use, and that happens to them all the time, and that they're really they feel lonely, they feel isolated, they feel completely abandoned, they feel not supported, and they feel sort of bewildered. And then the other, the other answers sort of line up, and it sort of by, all the answers. I mean, if you actually think about it, 20% for the Palestinian or other Arab women for feeling overwhelmingly sad. This is by 10% over the national average. The national sort of the case 6. I mean, this is what's interesting about you to think how to go about conceptualizing a research agenda. If you start with sort of national survey tools, which on an ANFO level is not necessarily always what you want to do. You want to be culture specific and sort of local. But if you do the national tool, then you can say, well, let me compare it to your data. And in mental health, the comparison is really off the charts. In all those categories, it's by half or by a third of the American equivalent. And interestingly, if you disaggregate the American equivalent, then to Latinas and Hispanic women, that's their category, and Black and African American women, it still is nowhere close. I mean, the minorities in the American sample are certainly more emotionally stressed, but none of that is comparable. So this really was a shock to everyone, the mental health data that we found. And if you could just go to the next one. And then, of course, we start looking for explanations. And so we look at income stuff, and you see that there's a lot of, the Yemeni lower than 30,000. I mean, there's a different income, and so there's a good amount in sort of middle income range. So is sort of more or less on the same page. Does that explain it? Go next to the next slide. Education. So here is sort of a clincher. No high school degree, and again, it's always the Yemenis who are in the dark column on the left side. The one that I was talking to. So that stands out in a really stark, way. And then I think there's one more slide. That's already the discussion. So there was one other sort of by age, sort of you're getting more stressed out the older that you get. And there was actually age-wise, there wasn't any, the distribution was the same. So here I'm actually giving you some of the numbers. And I said this is going to be such an unnatural thing to do. But what I'm presenting to you is the health survey that the Arab Cultural Center wanted to conduct. They did all this work, they collected it, and they brought me on because we could help with their data set. We actually entered the data set and did the SPSS analysis here on campus, and then gave the data back to them to do with SAP. So this is how, that was pro bono work that San Francisco State does. So communities want to do something, they lack a certain skill, they came here. And this is how I got involved in statistics. And believe me, I don't do statistics. So but this is, you have to basically be prepared in your research to go, where your community wants to go. And the director of the Arab Cultural Center said, I can better ask, even within my community, for help if I show my people the numbers. If I show them narratives, they're not interested. And I was like, okay. So what will work in what community is dependent on the community you have to ask, right? I was, in no shape or form, I was mostly listening to her and just cheering her on, keep going, but I had no sort of shaping in this. And in how the research in itself works. So this is how I ended up with all these numbers. And I still feel kind of uneasy dealing with numbers. Most of my work has been narrative and story-based and visual, but not this. And but it also visually is, if you just look at the data from the top, the 20%, 30, whatever, and the